Our internets don't exactly line up, so you get lots of layers and echoes. So we just mute everybody on the community of faith that I worship with, because we can't sing along with the piano, so we just sing at home and listen to the piano. So all right, well, thank you so much. It is time to get going. This is the Empowering You webinar for July 16th. The topic for today is vote as if your life depends on it. And also to get us ready for the big debate that we hope is coming in the U.S. Senate very shortly on federal relief that Missouri needs to make it during this pandemic. So our speakers today are Josh Protas, who is the Vice President of Public Policy and head of the DC office for MAZON, a Jewish response to hunger. He coordinates their advocacy agenda, including protecting and strengthening the federal nutrition safety net. They emphasize a lot the food security needs of seniors, veterans, and military families. He earned his MA in Western American History and Public History from Arizona State University, and his BA in American Studies and French Literature from Wesleyan University. We also have Namachat Adyang, the Kansas City organizer for Missouri Healthcare for All. Missouri Healthcare for All is an organization that advocates for quality, affordable healthcare for all Missourians. And it's Namachat's mission to mobilize and empower people in the Kansas City metro area to take action that affects healthcare policy in Missouri. She's been involved in community organizing for 7 years and is passionate about building collective power in ways that cultivate strong, authentic relationships. Hear, hear. Wonderful goal there, Namachat. And then Denise Lieberman, a civil rights attorney and nationally recognized expert on voting rights, recently Director of Power and Democracy at Advancement Project National Office in DC, a racial justice organization. She's also faculty director of the Voter Access and Engagement Initiative at Washington University in St. Louis and head of the Missouri Voter Protection Coalition. She's been counsel in significant voting rights litigation locally and nationally. So we're really, really pleased to have Denise and Namachat, because August 4th is our next chance to vote about some things that are incredibly significant. We have the chance to finally close the Medicaid coverage gap. And I know a lot of people are concerned about voting in this time of public health crisis. So Denise is going to help us know about how to make sure that we get our vote in and that it will count, since many of us will be voting by mail this year. I've applied I've sent my application in to get my ballot by mail. So Denise will make sure we know what's what. A few reminders about being on Zoom together. When you're not talking, please mute yourself. There's an icon of a microphone in the lower left of the screen, or you can use the mute and unmute option in the upper right of your own picture square. If you're on a telephone, you use *6 to mute and unmute yourself. And feel free to post a question or helpful links that you want us to see in the chat feature. A recording of this webinar will be available on our website at the events tab soon, and feel free to share that link with others, because we always want to be growing our advocacy network. So if you are not speaking at this time, we hope that you will make sure that you mute your telephone or your speakers. So without further ado, let's get going with Josh, because, and let me tell you this, a very important thing. Josh works for MAZON, a Jewish response to hunger. Empower Missouri just applied to their quick response fund for some money to do radio ads all over the state to make people aware of how food security needs are just growing in our state. We have a lot of people hungry right now. And we have a lot of people that can't make their rent. We just did a report that said that 18% of white folks and 30% of Black folks in our state could not make all of their rents at some time since March. So we've got some real housing and food security needs. We need our U.S. Senate to step up to the plate and pass good, strong federal relief. And so MAZON agreed to pay for some radio ads for us to make people aware of this situation and get them to come to our website so that they can reach out to Senators Blunt and Hawley. And we're so thankful for that. Those radio ads start to play today. So you may hear Empower Missouri's name cited on a radio station that you listen to, both in rural and in urban parts of the state and suburban. So thank you, Josh, and take it away.
Thank you so much, Jeanette. And now, as I've learned your nickname, JMO, I'm delighted to join you all today. And thanks for such a great turnout. We're big fans of Empower Missouri at MAZON and have been proud to be partners for a long time. And I know across Missouri, there's such a strong network of advocates who are passionate about taking care of the most vulnerable, of holding our elected officials accountable, making sure they're doing the right thing. And unfortunately, there's a lot of work to do. So everybody's participation and engagement and energy is really needed. So I'm delighted to have a chance to talk a little bit about the food security challenges that are exacerbated right now in the wake of the pandemic and the critical need for the Senate to take action. Just a little bit about MAZON. MAZON, a Jewish Response to Hunger, was born out of the vision that regardless of a person's circumstances, nobody deserves to be hungry. We're committed to protecting and strengthening the nutrition safety net for everyone who needs it. We're currently deeply concerned about populations that have long been overlooked, both by policymakers and unfortunately by a lot of the anti-hunger community, including military families, veterans, Native Americans, college students, single mothers, and seniors, and in particularly LGBT seniors. And I'll talk about a couple of those specific needs that can be addressed in COVID legislation as well. Before the pandemic, there were a little under, just about 40 million people facing food insecurity in this country. And let's just pause for a second and reflect on that. Before the pandemic, 40 million Americans. That's larger than the entire population of Canada, in the wealthiest country on earth. That's just morally reprehensible and unacceptable. It should never be that way. We should never have that many people struggling to put food on the table. One person struggling to put food on the table is too many. And yet so many of our friends, neighbors, family members are in that situation. And now in the wake of the pandemic, the challenges are exponentially greater. With skyrocketing unemployment, we expect that there may be close to 80 million people at risk of hunger, and maybe even more. The US Department of Agriculture, which is the federal agency that administers most of our federal nutrition programs, has unfortunately been too slow to respond to the needs of all those struggling with hunger. They've had, unfortunately, the wrong priorities in many cases. There are certainly great folks doing work at the agency, but under this administration, the leadership has been focused in the wrong areas. And they're even doing some things that try to restrict SNAP in the midst of this global pandemic. USDA is continuing to advance harmful rulemaking that would restrict critically needed nutrition benefits for certain SNAP recipients, which is completely contrary to their stated mission of do right and feed everyone. Instead of trying to boost the SNAP program, which has a proven track record for responding to critical needs in times of crisis, they've put more energy into creating a new program that needs a new infrastructure with the Farm to Families Food Box program. It's an admirable idea about getting excess food to help both farmers and those in need. But the problem has been racked by lots of problems, including contracting to parties that had no experience in doing this, extra costs, and unfortunately a delay in getting assistance to people who really need the help. About 2 months ago, the U.S. House of Representatives passed the Health and Economic Recovery Omnibus Emergency Solutions, or HEROES Act. Congress loves these acronym bills. This bill, the HEROES Act, would provide about $3 trillion in economic relief for those affected by COVID, including a badly needed temporary boost to SNAP benefits for millions of Americans who are facing food insecurity. Unfortunately, the HEROES Act wasn't perfect. There's a few areas where critically important provisions were left out that would address long overlooked challenges of hunger among military families. And it also failed to ensure SNAP benefits could be continued for college students who lost access to those benefits because of the pandemic. So the HEROES Act could go a little bit further, and there's still an opportunity, hopefully, for the Senate to fill in some of those gaps. But the HEROES Act was a very important piece of legislation on the House side. And just to recap some of the things included in that: primarily boosting the SNAP maximum benefit by 15% through September 31st, 2021. Now, the 15% boost to SNAP is really important, even though previous legislative COVID relief packages had included some nutrition assistance benefits and including some improvements to SNAP. The most vulnerable in our communities were left out of those improvements. So the roughly 40% of SNAP recipients who already received the maximum SNAP benefit have received no added help. And we've seen rapidly rising food prices that are really hurting people's bottom line. And for these most vulnerable households who have little to no other source of household income, that SNAP benefit really helps keep them whole and put food on the table. And without that 15% boost, they're really going to be struggling. So that's a critical piece that needs to happen. We'd also like to see, and this was included in the HEROES Act, increasing the minimum SNAP benefit, which currently is set at $16 per month, raising that to $30 per month. That would help low-income individuals, particularly low-income seniors who might receive that minimum SNAP benefit. And then we'd also like to see suspension of harmful SNAP rule changes that have been promulgated by this administration. That suspension of harmful SNAP rules was part of the HEROES Act. Other parts of the HEROES Act that we'd like to see in Senate action include extension of the pandemic EBT program. PEBT is a new program that has been ramped up to respond to the needs around the pandemic. This essentially is a replacement benefit that would replace the value of subsidized school meals that are lost due to school closures. It would be conveyed in the form of EBT benefits to households and enable them to help feed their children, replacing those school meals. And I think we're seeing a lot of news right now about school closures that are going to be extended into the fall and possibly beyond, despite what the administration is doing in pushing for school openings no matter what, which is highly problematic. In addition, the HEROES Act increases the value of the WIC cash value voucher through September of 2020, the end of September of 2020, and provides $1.1 billion to ensure that WIC funding is sufficient to cover any increased participation. And the WIC program is the special supplemental program for women and infant children. So for pregnant moms and young infants, it's a critical lifeline. There's also some provisions to temporarily allow SNAP to be used to buy hot foods, prepared foods. There's some places where that was available pre-pandemic, and this provision would widen that scope to make more prepared foods to be able to be purchased by SNAP. And then again, and then one more thing, this would provide additional funds for the Child and Adult Care Food Program, the National School Lunch and Breakfast Programs, and other emergency food providers, including TFAP, the Emergency Food Assistance Program. Just want to highlight, and I think all of us have seen the stories on the news of lines of cars miles deep waiting for emergency assistance, or socially distanced lines of people standing hours to get emergency food, sometimes that runs out before the distribution can meet everybody's needs. The charitable sector cannot fully address the needs. It never was set up with the capacity to meet the needs of hunger in this country at the best of times, and certainly at a crisis like this, there's just not the capacity. Our food banks and food pantries are working hard. They're doing the best that they can, but they have limitations, and they shouldn't be expected to help meet these needs. The collective responsibility to take care of the most vulnerable, to put food on the table, that transcends faith community values. I come from MAZON, a Jewish response to hunger, where we reflect deeply about that responsibility, the commandments to take care of the most vulnerable. In the Torah, we're told to set aside the corners of our fields for the poor, the orphan, the widow, the stranger. Well, we're not all farmers. We don't all have fields today that we can set aside the corners of our fields from. Programs like SNAP essentially fulfill that collective responsibility in today's world, in today's modern world, where we all contribute through our taxes to programs, to safety net programs that are there to help those who struggle. So really comes from a deep place of moral values about how we take care of each other and take care of the most vulnerable, and it shouldn't fall on charity alone to do that. Want to note a couple of other things. So that was a recap of what's in the HEROES Act. This is now many weeks that the House has passed the HEROES Act, and there's been crickets on the Senate side. We've yet to see legislation. Senator McConnell has said, well, we need to wait and see the impact of already passed legislation and, see where the needs still are. He's prioritized liability protections for businesses. That seems to be his top line priority. Liability protection shouldn't be the first concern. We should be concerned about the livelihood of our brothers and sisters who are struggling, making sure that they can put food on the table and take care of their basic needs. Those who are deeply struggling at this moment because of unexpected unemployment, of healthcare challenges, shouldn't have to wait. They don't have the luxury of waiting to see what the impact of federal legislation is. There are hungry Americans in every community who don't know where their next meal is going to come from. If Senator McConnell thinks that they can wait months while he deliberates and figures out what's going to work best for American businesses, he's dead wrong. They can't do that, and people are hurt by his inaction and by the Senate's inaction. So there's a critical need for the Senate to step up, particularly for Republican senators, to show a backbone here and to show that they understand the needs of Americans who are struggling and that they can't wait. So invite you to join MAZON and join Empower Missouri. There's lots of ways to weigh in right now. This coming Monday is going to be a national day of action to push for SNAP in the next COVID package. You can go to MAZON's website. There's an action alert there. You can find information about all of the different programs that I've mentioned to you that were in the HEROES Act and kind of the specifics. If you go to mazon.org/COVID, and we can maybe send this out as a follow-up. Happy to share that information with you. One of the things that we found to be particularly powerful in highlighting the level of need is sharing personal stories of people who are impacted. I think often the issue of hunger gets talked about in terms of statistics, and I've done that to some degree here too, but we can't lose sight that these are real people who have very real and difficult stories. And to be able, when you're talking with elected officials, talking with staff members, to highlight those personal stories, it makes a huge difference. And certainly stories that come from communities in Missouri is great. If you're looking for stories, MAZON has a bank of stories about what food insecurity looks like in America. It's on our website. There's the This Is Hunger traveling exhibit that many of you saw when it was coming through Missouri. It's now a digital experience. There's also a video program of that too, and it's a great way to highlight and lift up the personal impact of the issue of hunger. And as Jeanette mentioned, the Quick Reaction Fund that MAZON has. So if any of you are with other agencies or organizations where there's a need to respond to a quick threat, an immediate threat to safety net programs or to take proactive action, we invite folks to submit applications for that. Before I finish, I know my time's almost running out. I did want to mention one of the special populations that I alluded to at the beginning, and this is military families. And while it's unacceptable that any American struggle with food insecurity, it is shameful that we have currently serving military families across the country who struggle to put food on the table. And this is due to a quirk in SNAP eligibility guidelines that makes it more difficult for these currently serving families. They're primarily junior enlisted members who have larger households, and their housing allowance gets treated as income and pushes them outside of SNAP eligibility guidelines. And as a result of this, they're turning to food pantries that are operating on or near almost every military base in the country. It's been a shameful issue that's been allowed to persist for many years. MAZON has been leading the charge on this for nearly a decade. It's been, even though there's broad consensus that we want to help military families, actually getting this resolved has been very, very stubborn. We've tried addressing this in the Farm Bill context where the SNAP program is authorized about every 5 years, and unfortunately was not included there. We're working closely with partners in military service organizations, and particularly National Military Family Association. And we've crafted a provision that's right now in the House National Defense Authorization Act. It's not in the corresponding Senate NDAA bill right now. This would be a provision to provide some added financial assistance to service members who are at or below 130% of the federal poverty line. And again, just think how wrong that is. We ask these men and women to put their lives on the line for our country, and they're struggling to support their families below 130% of the federal poverty line. It's just ridiculous. This is a very common sense proposal that would provide targeted assistance to these junior enlisted members. And want to note that right now, in the context of COVID, military families are even harder hit. One of the challenges for these households is a high rate of spousal unemployment. Before COVID, it was about 24% of military spouses were unemployed. That doesn't even take into account underemployment. We have seen from surveys that those rates are spiking now as a result of COVID. So more of these military households are struggling. And then I also want to note, in this context of greater public awareness about racial inequities, to recognize that our junior enlisted ranks are overrepresented by service members of color, and that there's been a long-standing problem of a lack of service members of color among the officer ranks and in military leadership. So this military hunger issue disproportionately impacts service member families of color. So it's a racial equity issue to address this, not to mention it's good policy to make sure that we're doing right by our military families. I have to say that your Senator Hawley has been incredibly disappointing on this. He serves on the Armed Services Committee in the Senate. I spoke with him personally. I grabbed him in the halls as he was finishing a meeting with somebody else back before quarantine, and raised awareness about this issue. And he sounded concerned about it, but there was no follow through. And it's been very disappointing to see that Senator Hawley instead has prioritized his leadership trying to push for preserving the naming of military bases in honor of Confederate generals. So he seems more concerned about honoring a shameful legacy rather than doing right by those who are serving our country today. He needs to be told to stand up and get his priorities straight. He could make a difference as the Senate finishes consideration of the NDAA bill, and there would be an opportunity for him to be a co-sponsor of a provision, a bipartisan provision that is being led by Senators Tammy Duckworth and Senator Lisa Murkowski. So I've shared a lot of information. I know I speak quickly. I'm sorry about that. I'm happy if there are questions that folks have, or if anybody wants to follow up offline later, happy to chat, and really, again, appreciate all of your participation on this and your support and concern about these issues.
Okay, thank you, Josh. Does anyone have a question for Josh? You can either unmute yourself and ask the question aloud, or you can type it into the chat box.
Hey everybody, this is Sarah. I'm the Policy and Organizing Manager. I wanted to let you know that I learned a little bit of information this morning on a phone call. It seems likely we'll hear a Republican Senate response early next week. So that makes these days of actions with MAZON and NLIHC even more important, that the early part of next week we really focus hard on what we want in that federal package. So thank you so much, Josh, for joining us, and I just wanted to point that out.
Thanks, Sarah. And just a note about that, I think the Republican Senate caucus is going to be meeting on Tuesday morning, and we're expecting to see the outlines of their package. From what Senator McConnell has shared in the press, he's talking about a much smaller scale of a COVID relief package than the HEROES Act. HEROES Act was over $3 trillion total. He's talking about a cap probably of $1 trillion. We're very worried that all he might propose in the nutrition space would be something to address childhood hunger, maybe the extensions of the pandemic EBT program. Failing to include the critical SNAP boosts would leave out millions of Americans who are struggling, and particularly the most vulnerable. So reaching out to Senate offices between now and Tuesday is critical to try and put pressure to get them to do what's right and have a more moral response to this crisis.
Thanks, Josh. And I wanted to make sure people know kind of where you find on our website to take action to reach Senator Blunt and Senator Hawley. When you get to our main page, you know, the www.empowermissouri.org, you pick news and updates, and then you pick the COVID-19 call to action right there, and that gives you a little bit of information about housing and health, housing and food needs. And if you click on where it says take action now, that lets you write an email right to Senator Blunt and Senator Hawley. The link below it gives you a fact sheet that talks about things like how many Missourians have lost income because of the pandemic, how many people are having trouble having enough food on the table, how many people are having trouble with rent. So there's some facts there that you can pull by clicking on that document. And then if you want to hear those wonderful ads that MAZON, A Jewish Response to Hunger, helped us to pay for, you can play them right there on that page and hear what those sound like. The Take Action page looks like this. It gives you a chance to put in your information so the senator will know. You can tell us, well, I called them instead of doing the email. To do a call. It lets you tell us if you forwarded this message to your friends, if you shared it on social media, gives you a chance to donate to us, which is always important. And then down here is a template that you can use to write them. Be sure and change the subject line to what you want to say. Like you can change it to please raise SNAP benefits, or whatever you want to emphasize. And then if you personally message, it will be more effective because I'm a former legislator, and I know when I got 500 things that all looked alike, I knew that it took people literally 1 second to send that to me, and it made an impression on me, but not nearly as much as a personally written thing that said, I volunteer at a food pantry in my community, and we can't keep up with the need right now. So if you make it personal and tell your own story, your advocacy will be more effective. So we hope that you will edit that when you use it. And as Josh said, if you can help us get hundreds and hundreds of contacts to the senators by next Tuesday, that would be really vital. So please take that link and share it in social media, the different accounts that you use, and invite people to get active with us on this issue. We have a goal of making at least 2,000 contacts with Blunt and Hawley, and we can't do that without your help. So if each of the, what do we got right now? 53 people. If each of you will do 5, if you'll get 5 people to do it, we'll be well on our way. We'll be, past 10% of our goal in a day. So let's see a show of hands. Will you recruit 5 people to contact Senator Hawley and Senator Blunt? All right, I see some hands. All right, very good. There's Reverend John Bennett. Won't you pass the offering plate for us, John? All right, it's good to see you. Thanks, Josh. Anybody else got a question for John? Oh, we've got a hand up from Barbara Baker. Barbara, what would you like to ask? Don't forget to unmute yourself. Oh, maybe Barbara was raising that hand to volunteer to do 5. That's great. Very good. All right. I don't see a question in the answer box, the chat box. Any other questions for Josh? All right. We really appreciate you being with us today, Josh. And anything, final words you'd like to say?
No, I just appreciate all of your engagement. Empower Missouri is such an important organization. And you've been fighting for a long time for folks all across the state. So thank you. And I'll stick around. I'm interested to hear the other presentations. And if there are questions later that come up, I'm happy to try and answer.
Wonderful, Josh. We appreciate that. Yes, I always say we were founded in 1901, but I was not the founding director. So we'll go to Namachat now to talk about the Vote as If Your Life Depends on It section of today's program. It is vitally important that we get to the polls on August 4th. We have the chance to do something that Empower Missouri and other social justice organizations around our state have been trying to do in Missouri for years, which is to close that Medicaid coverage gap that leaves over 220,000 workers with low wages out of affordable health care. So Namachat, we'd love to hear from you.
Hi, everyone. I'm going to first share in the chat. We at Missouri Healthcare for All, we have a story bank organizer, and the other organizers worked with them to put together a storybook that talks about some of the Missourians and what they've been going through in terms of healthcare, as well as information related to Medicaid purge and healthcare outcomes that all relate to different issues from chronic conditions to maternal outcomes. And then I'm also going to put in the chat the fact sheet for Yes on 2. Give me a second. Okay. Okay. Hi, everyone. Like JMO was saying, my name is Nomachat Adyang, and I'm an organizer for Missouri Healthcare for All. Just a little bit about me. I am a refugee. I came from South Sudan with my family when I was younger, and I mainly grew up in the northeast region of Kansas City for most of my life until I went to college and then came back. So, you know, at Missouri Healthcare for All, we are trying to focus on anything that gets us to a place where we can give every Missourian access to quality, affordable healthcare. And so we jumped on the opportunity to be involved in this statewide initiative to expand Medicaid. And so I know a lot of you probably know what that means, but I'm still going to go ahead and just talk about the basics. So in the state of Missouri, most individuals who don't have children, or don't have any dependents and don't have any kind of disability do not have access to Medicaid. And the income requirements for Medicaid is about 22% of the poverty level. And the state of Texas is the only one that's worse than Missouri in terms of those guidelines. So an individual cannot make more than $2,800 in the state of Missouri to even access Medicaid. And for like a family of 3, that would be $4,600. So you can't make more than $4,600 while supporting 2 children to get access to Medicaid. And so the expansion would increase the requirements to 138% of the poverty level. So that for the family of 3, the requirement goes from $4,600 to $30,000 a year that you would be able to qualify for Medicaid. It also means that individuals who make about a little under $18,000 who don't have dependents would actually qualify as well. And so we are expecting to see almost 250,000 Missourians gain access to that healthcare. And in terms of the vote, it's more about, I see it as like we're righting the wrong of the past decade, because we had about almost 10 years of opportunity to get 100% reimbursement from the federal government, and we did not do that as a state, all because of political reasons, and none that really make any sense. In terms of like what the impact on the state of Missouri has been, we've had 15 hospitals close in all since 2014. It's such a short amount of time. Most of them have been in rural areas, and a lot of that does come from the fact that, you know, when you don't expand Medicaid, there are a lot of people who have different chronic conditions, even something as simple as diabetes, all the way to like a lot of, like, even the Medicaid related to pregnancy is very stringent. You don't get it before, you don't get it after. So you are only supported during your pregnancy, which has caused a lot of problems in the state of Missouri, because in the storybook link, the PDF I shared, in the state of Missouri, we are ranked 44th in terms of maternal mortality in 2019. So that means we only have 6 other states that have worse health outcomes for mothers. And when it comes to the disparities between Black and white mothers, it's even worse. You see way more deaths for Black mothers than you do for white mothers, and a lot of it has to do with what they say the health outcomes before and after pregnancy. So a lot of women don't have any. So single women like myself, I didn't have any access to healthcare. So if I had any underlying issues that could have affected a pregnancy, I would not be able to deal with them until I'm already pregnant. And sometimes those services lag. So you're not getting it like as soon as you find out that you're pregnant. And so you might have underlying issues that you did not deal with because you've gone your adult life not having any access to healthcare. Then you get it. And those kinds of things are very preventative. Like if adults already had that access, then they would already know, maybe they have to work on the hypertension or things like that. It would prevent them from having the risky pregnancies. And then during the pregnancy, a lot of mothers have found that Medicaid has been very helpful during the pregnancy. But the other issue too is that you're actually more likely, there's more risk of dying as a mother after labor. And so it says more than half of pregnancies related maternal deaths occur after delivery. So between one to about 40 days, actually, you're highly likely you're at risk from dying related to, they still consider that maternal related death. And so this would also impact the health outcomes for a lot of mothers. And a lot of the costs that we are seeing is because people don't have healthcare, and so they have to go and get services only when there's an emergency, only when it's serious. And as we know, that's where a lot of the costs happen. Also, this will bring money back to the state of Missouri. We're expecting about $1.6 billion. I think it's $1.6 billion by 2026. And we're expecting it to create 16,000 jobs a year on average. And so this will bring more money back. And these are healthcare related jobs throughout the state of Missouri. So it has the opportunity to kind of build back the the loss that we've had in terms of a lot of the hospital closures. And as we know with COVID, this has had an impact because of capacity. It's not good to have in only 6 years to have 15 hospitals closed and then have a pandemic. It puts a lot more strain on all the hospitals to try to support that, along with all the other healthcare concerns. Yeah, so this will, so again, it will increase the income requirements so that a lot more Missourians will have access to healthcare, which means people can get more preventative care. So we're expecting there to be a reduction in healthcare outcomes, a reduction in expenses, and some programs, we're going to be expecting for most programs to get 90% reimbursement for Medicaid-related programs. I think that's most of what I wanted to talk about in terms of the actual ballot initiative on August 4th. This relates to it being it's a yes on an amendment 2 in terms of trying to expand Medicaid. Oklahoma has just it's the 38th state to also do the same thing we're about to do. They also voted on it, but it was a very close margin. So I think it was like less than 1% for Medicaid as opposed to against it. So they were able to pass it, but it was such a small margin. As we know, there's all turnout in August in general, and with the pandemic, it does kind of make it a little bit difficult. But like I've said to most people, of course, it's great that we're getting, the ability for Missouri to get money and stimulate the economy, but also like these are jobs. Like our lives really do depend on it, because when people didn't expand Medicaid, people lost their lives. And I think that's what we have to see, that we're talking about lives here. And as much as we try to turn it political, everyone needs access to healthcare. And the other thing that I think is interesting too is that it benefits a lot of older adults, especially ones that they're not old enough to get access to Medicare. They fall in this gap, and it ends up being a lot of cost, because as we know, children don't really put a strain on the healthcare system as much when they're growing up, because they don't really have as many health concerns. But the older you get, the more those costs accrue. And when you have to wait until you're 65 years old to get Medicare, there's a lot of problems that happen that cause you to. Sometimes even some of the families and people we talked to in our storybook, they had to move. They had to lose their house to afford things. People couldn't keep jobs because they had type 1 diabetes and couldn't afford to get the medication they would need to maintain. And that to me is just really not okay. So that's basically the kinds of things that we're trying to address for 230,000 users that would have access. I think that's as much as I have to say about that. I know sometimes people have a few questions about the money, but does anyone have any questions?
Any questions for Namachat?
Namachat, the files you put references to at the beginning look like they are to a private server and not through the internet. So I don't think we can access those.
Okay, I'll try to see if it doesn't work. If I send it to you, will you be able to send it to people on the?
What we can do is on the recording, the recorded version, there'll be documents that people can download, including my slides from today. And we'll just put your link there for people to click on it. Okay.
Okay.
Right.
I have a question. What are the primary arguments against Amendment 2?
Actually, the primary arguments against it have to do with money. They say that somehow it's fiscally not responsible, and that a lot of times they'll bring up the Missouri budget and say that, and they've used education a lot, say that somehow if we try to expand Medicaid, that the state of Missouri wouldn't be able to afford to fund education programs. So they kind of try to pit different programs against each other. And I actually just did something on NPR, and they had Senator, I don't know how to pronounce his name, is it Hegeman or Hegeman? And he tried to do the same thing. And I asked the question of like, well, if that was the case in terms of education, then we didn't expand Medicaid for 10 years, and the U.S. still cut the education budget. So obviously it has nothing to do with that, but that's the argument they're using, that it's going to cost us money as a state. But someone from the Health For Foundation brought up a good point and said that if it was really that bad for states, how come none of the states that have expanded have gone back on that? They have not changed. They have not gone back and said, we don't want this anymore. And so obviously it's something that's essential. But yeah, the main arguments have to do with money, that the state of Missouri is not going to be able to afford it. But we honestly can't afford not to have it because of, I don't know how else we would be able to get repair the fact that we've lost 15 hospitals, or repair like our health outcomes without this funding.
Has this Healthcare for All have any phone banking going on regarding trying to get citizens to vote?
Yeah. Yes, we actually, the coalition has had individual phone banks, but actually by the time that this gets shared, I think the best thing to do, and this should work, it's the website, the website for Yes too, because between the 23rd and August 4th, we're going to be doing phone banking collectively. And so you will just be able to go to that website and volunteer that way. That I'll try to see if I'll get that to JML as well.
Thank you.
Great. I know that we staff the Missouri HIV Justice Coalition, and I think it's maybe tonight that they are doing some phone banking on Yes On 2, or participating in that. So let's see. Debbie Pratt says you can sign up at Jobs with Justice.
Mm-hmm. Yeah.
Debbie, you want to talk about that? Go ahead. Are you unmuted, Debbie?
I don't know about Debbie. This is Josephine Girardi, and I do know Jobs for Justice is doing phone banking. And I had that number, but I don't have it right in hand. But just get in touch with Jobs for Justice, and
yeah.
I was going to say either Stand Up KC, which you're in touch with Jobs for Justice to do phone banking.
Yeah, and the reason I brought up Yes on 2 is because we are all working together. So we're all going to be, we've all signed up for roles, and we've done phone banking individually with our members, but we have way more shifts that are going to be happening on like the week of, because people are going to be more likely to vote if they're getting the information within that week. And so while Jobs with Justice is doing that, Jobs with Justice is also going to be part of that same Yes on 2 phone bank for that week. And that's where most of our shifts are going to be.
This is Patty Berger. I'm with All of Us, the non-St. Louis chapter. And I'd like to add that Medicaid expansion is so important, as it even if you look at crime, because a lot of people are being released out of jails and prisons who have no health care, and they're on mental health meds. And once they come off the meds, that's when behaviors start to pop up and they end up back in the system. People who are released from prison a lot of times have been on medications for years, and to lose that connection of being able to get what they need, Medicaid would make a big difference. And I think it would assist us with, calming down the crime. I know that the governor is coming to St. Louis to address that. I think maybe today even, I can't remember. But, everybody seems to be zeroed in on crime and violent crime especially. So, that's a talking point that we can use also.
Yeah, Patty, you bring up a good point, because if we really wanted to reduce crime, it's more about providing different services, as opposed to, as we know, over-policing doesn't work. It's never worked. They keep trying to do it, and it costs us so many. It costs us lives. It costs us money as well, just for something that doesn't work. So, yeah, when you provide services, when you provide people jobs with dignity, that are, with a living wage and healthcare, where would there be a need to commit crimes? But yeah.
And that's a winning plan. It really is.
Mm-hmm.
Thanks, Patty, for a very good point.
Yeah, I had a question. This is Charlotte Moten, and I have about 700 clients that have spin downs, and this may be getting into the weeds a bit, but I was just wondering if passing Medicaid expansion would affect spin down for Medicaid.
Good, because my understanding with spend downs is that you're spending down to, so let's say for me to have Medicaid, I would need to make $18,000, but I make $19,000. I would have to spend down to the $18,000. Is that correct?
Something like that, right?
So yeah, it would definitely affect it in terms of, that means if the income requirements are higher, in theory, you'd have less clients that would have to do the spend down. They would just have Medicaid.
Okay.
I work with a lot of people on Medicaid also, and my understanding is they can have accumulated more than $2,000. If they do, that's when they lose their Medicaid. So that means, people that got stimulus checks, the $1,200, well, they did put a little bit of longer time limit on the $1,200 to be able to spend it, so it doesn't go up to the $2,000 so quickly. So it's more than just income annually, it's monthly also that they're checking that.
Thanks, Maddie. That's very helpful.
Good question, Charlotte. I hadn't heard that one before. Any other questions for Nomashat?
This is Linda again. Do you guys have any polling or any other means of determining how much support there is outside, in a general population for the initiative?
Yes, that's a good question, Linda. We do have polling. Not so far. It's kind of just like what we've seen in Oklahoma, cutting it very close. The very 50-50 line is where we're at. And so, and then I think because it's a pandemic, because the thing was with the campaign, because we started August of last year with signature gathering. The goal was to spend all of this summer doing political education on Medicaid expansion. What does it mean? All that stuff, but with the pandemic, and then with with the Secretary of State put it on the August ballot as opposed to the November ballot, which is what we expected. It didn't give us much time, and so that's why phone banking and all the efforts we've been having is going to be more important than ever, because we're probably going to be just like Oklahoma, where we're kind of very close in terms of more yeses than nos. And just so you know, if you go to so I think what I'll do is when Denise speaks, I'll try to get better links and get the Yes on 2 one, because the Yes on 2 is like the larger campaign that we're working under. And they've been doing, you can pick up yard signs in your local cities. They have this vehicle that goes around, it's called Marv, that kind of is about Medicaid expansion. So there's like different levels of things that people are doing to try to get the word out. But that website is gonna be the best place to go for a lot of these things, because we're all gonna be collectively working under Yes on 2 when we get closer to the election.
This is Josephine Girardi. I put the information for Jamison Wells, who's at Jobs for Justice for phone banking, in the chat room.
Yes, and I know Jamison. He's really great.
Okay.
Thank you, Josephine. And I'd like to honor people that collected signatures on petitions in order to get this on the ballot. Down at the bottom of your screen, it says reactions. Well, everybody on this call that collected signatures, use the hand thing there to show that, you know, the thing that looks like, look at my picture, see that little hand there? Raise your hand to show that you collected signatures on the petitions. There's some hands going up, several. Thank you, Jonda. Thank you, Debbie. Thank you, Kelly. Thank you, Charlotte. Thank you, Sarah.
And it looks like Sean, our policy director, put information about the spend down. Thank you, Sean.
Excellent, Sean. Thanks so much. Well, one of the good things here in Missouri is when the legislature fails to act, if the General Assembly just won't listen to reason about the good economic sense for why we would want to do this. And Chris Gunther, thank you for collecting signatures. If the General Assembly balks, we have the ability to do ballot measures by petition signature gathering. And that's the way we were able to pass clean in 2018 and the way that we were able to raise the minimum wage. And that's direct democracy, where we decide to take the power into our own hands. So we have the chance to finally solve this Medicaid problem. Namashat is telling us that we all have to talk to our neighbors and make sure that they remember to vote on August 4th. And if you're doing a mail-in ballot, I understand that this is on the back of the ballot. So you need to be sure and turn that ballot over and vote on the back of the page. So let's make sure that our friends and neighbors know how to do this. We have some special circumstances that make this kind of a harder challenge than it would be because of the pandemic. Let's go to our next speaker, Denise Lieberman, that's going to talk about those challenges of voting during a public health crisis, to make sure that we all know how to do that and don't miss any deadlines. It's important that we get those ballots mailed in early, because the Postal Service is a little slower these days than it used to be. So Denise, fill us in on what we need to do to make sure that we can get our vote counted on August 4th.
Thank you so much, JMO, and thanks to Empower Missouri for hosting this really important and just information-filled webinar. I've learned so much. JMO's right. We need to get out there and vote. We've got so many important things on the ballot that we have to work for, but it's all for naught if votes won't count. So I'm going to share a few slides, as you know I want to do. But do think it sort of helps. And so for those of you who don't know, I'm here on behalf of the Missouri Voter Protection Coalition. We are a nonpartisan statewide network of voter advocates that work to protect the right to vote. And so let's just jump right in, because I know I only have a few minutes. First and foremost, check and confirm your voter registration. This is just a helpful piece of advice that you should do before every election. While the voter registration deadline has passed for August, you should still go and check and make sure that you're registered. If there's something off, then go ahead and correct that. You should also, if you're planning on voting in person, you should confirm your polling place. Particularly in the wake of the COVID-19 pandemic, many election jurisdictions have found that they've had to close or move or consolidate polling places. In some cases, because a place might not be really amenable to in the midst of the pandemic, like say voting at a senior center or a school. In other cases, because of challenges finding enough poll workers. So just because you voted in the same place for the last 20 years doesn't mean that you're going to be voting there this time. So if you're planning to go out and vote in person, double check that polling place, because in Missouri, you have to be in the right place for your vote to count.
Denise, are you still there? Are others here having trouble hearing Denise? Denise?
Yeah, I can't hear at all.
Okay. Let me text her to make sure she knows that we have a little problem here. Internet has been a little weird lately. Maybe she knows she's off and is going to come back here in a moment.
J-Mo, ask her to unmute.
Oh, is she back? Denise, yeah,
Well,
give it another try.
Whoops. I apologize. I don't know what happened there. Here we go. Let's see if I'm back on this one. My computer just crashed. It is coming on momentarily.
Sounds like you had an intermittent internet kind of problem, which has been happening in my house quite a bit this week. I don't know if it's because so many of us are working from home and broadband is kind of strained or what, but I know we got fiber optics here not too long ago, and I had pretty steady service until the pandemic when it's been a little weird. So.
Well, I apologize about that. And I'll just kind of keep going here from my phone.
Okay.
But I think this actually is coming back up online. Okay. Okay, my apologies, everybody.
Technology lets us down sometimes. Yep, we can hear you.
Okay. So I don't know what happened to my slides here. They disappeared as well. So I'm just going to talk because I know my time is very limited anyway. So I did have slides. I'll try and share them later. So in Missouri, if you want to avoid, we talked a little bit about what you're going to do if you're going to go to the polling place. You need to check and confirm your polling place. But if you wish to avoid the going to the polls on election day, there's several ways that you can do so. Okay. And we are back in business. Okay, and in that many of you are going to want to probably vote by mail, just like people are wanting to do across the country. It's a little bit challenging here in Missouri because unlike the vast majority of states, we don't automatically allow anybody to vote by mail. We make them list a certain number of excuses. But the Missouri legislature did pass a law in recognition of the pandemic that will expand options to vote by mail this year. It does a couple things. It adds a new basis to vote absentee for anybody who is considered at risk for COVID-19. And that would include, and those people can vote absentee without a notary. And that's gonna include any of the people in this category. So any voter over the age of 65 or So this is not an and. Or any voter in a long-term care facility, or any voter with chronic lung disease who has moderate to severe asthma, a condition that impacts a lot of people in our community. Anyone with a serious heart condition, anyone who's immunocompromised, anyone with diabetes, liver disease, chronic kidney disease, and is on dialysis. And these folks will be able to cast an absentee ballot with no notary requirement. So if you are working with populations that fit any of these categories, please help make sure that they can get an absentee ballot application. It looks a little bit like this. So for example, I'll just give you an anecdotal story. Talked with a voter who is on dialysis, and she went and asked her dialysis center if they would put a whole stack of these applications out, since literally every single person walking in there who's on dialysis is eligible to vote absentee under this provision. So think creatively about the populations that you serve that may have challenges getting access to this information to help provide it. Even if you don't meet one of those at-risk categories for COVID, there may be other reasons that you can vote absentee as well, including reason number 2 that a lot of people are using. And that is if you expect to be incapacitated or confined due to illness or disability, or you're serving as a caretaker for somebody who is, you can vote absentee also with no notary requirement. Now, we have argued that in the age of COVID, people who are quarantining, practicing social distancing as the Centers for Disease Control recommends to avoid contracting or spreading COVID are literally confined due to illness and should be able to vote absentee under this provision. I'll say we are currently in court seeking a definitive interpretation of the statute to that effect. A judge denied a request for preliminary relief in advance of the August elections. So we don't have any firm guidance on this provision for August. We have also challenged the notary requirement for the other bases to vote absentee. But if you do select excuse number 2, confinement due to illness, or excuse number 7, that you are in an at-risk category for COVID, you do not need to have the ballot notarized. And I'm emphasizing this because that notary requirement adds a whole additional layer of challenges. You also don't need to notarize the ballot if you're on the permanent absentee list, which isn't that hard to get on if you have ongoing issues that you believe could impede you from going to the polls, or if you're a military or overseas voter. The legislature did something else as well. In addition to creating this category to vote absentee with no notary for people who are at risk of COVID, it also passed a law saying that any voter in Missouri can vote by mail. But keep in mind, the rules are a little bit different than they are for absentee. And so let's go over those real quick. Step 1, for either one, if you want an absentee ballot, if you meet one of those 7 reasons, or a mail-in ballot, you do have to apply for it. It won't come to you automatically. And you have to submit that application to your local election authority, which is basically your local county elections office. And for people in St. Louis area, Kansas City area, that's gonna be your local election board. In other places in the state, that's gonna be your county clerk's office. And again, the application looks like this. Local election jurisdictions may have differing versions of that on their websites. It does not matter which form you use, but you do have to do a few things. If you are applying for an absentee ballot, you could see here where I've highlighted absentee ballot, you have to indicate one of the reasons. If you do not indicate the basis for which you're voting absentee, they will reject the request. Now, if what you are requesting is a mail-in ballot, you just check the box that you want a mail-in ballot, no reason is necessary. I will also say this, you do not need to provide documentation of the reason that you are voting absentee for that reason. So for example, if you say, I'm gonna vote absentee because I'm confined due to illness or disability, You do not need to disclose the nature of the illness or the nature of the disability or impairment. You do not need to provide doctor's notes or anything like that. Similarly, if you're voting absentee under number 7, you're in an at-risk category for COVID, say because you're immunocompromised or because you have liver disease, you do not need to indicate which of those 8 reasons that you are at risk, nor do you need to provide medical documentation of, what your condition is that leaves you immunocompromised, for example. Just like if you were going to be outside of your election jurisdiction on election day, you don't need to provide a copy of the train ticket showing that you're going to be outside of your election jurisdiction. Or if you have a religious belief or practice that prevents you from going to the polls, you don't need to provide a copy of a religious text that documents what you're going to be doing that day. But you do have to indicate it on this form. Finally, regardless of whether you are applying for an absentee ballot or a mail-in ballot, you gotta sign the form. If you don't sign the form, they will reject your request. Now you filled out the form, you gotta get it in time. And for the August elections, that deadline is next Wednesday, July 22nd. And that is a deadline by which it has to be received by the election authority. So you can't stick it in the mail that day. Now, again, remember, if you are requesting an absentee ballot, you can make that request by email or by fax or in person or over the mail. But if you are requesting a mail-in ballot, that can only be submitted by mail or in person. Okay, now you have submitted your request. They're going to process it and mail you a ballot. Please keep in mind, and I'm going to emphasize this a lot, they are overwhelmed. These local election officials are overwhelmed with numbers of requests for absentee ballots. I was just testifying before the Human Rights Commission with the directors of the St. Louis County Board of Elections, and they indicated already for the August elections, they have 80,000 applications for absentee ballots. In contrast, in the August 2016 elections, also a presidential year, they had just 15,000 absentee applications. So it's taking them a long time to process these things. It may be a little while before you get your ballot. So don't delay if you think you want a mail ballot. Cast your ballot just like you would if you've never done absentee voting. That ballot's going to look like a paper ballot that you would get at the polls. You have to fill in the circles. You then need to put it into the postage prepaid envelope that's been provided. It does provide for prepaid postage, but keep in mind that is business delivery postage, so it could take 5 to 10 days for that envelope to get back. And you have to complete the form that's on the envelope. The form on the envelope looks a little bit like the application that you originally filled out. You attest to your name that you're eligible to vote. If you're voting absentee, you indicate the reason why, but you do have to sign that envelope. And if applicable, you need to sign it in the presence of a notary. So again, let's just remind ourselves that several reasons do not require a notary. If you are voting absentee on the basis that you are confined due to illness or serving as a caretaker, no notary required. If you are voting absentee because you are in one of those at-risk categories for COVID, no notary required. The other ballots do require a notary. In addition, I want to say that voters have a right to assistance in casting their ballots, even if those are mail ballots. But if you, and you have a right to assistance by a person of your choice. If somebody assists you in casting the ballot, they also have to sign. So using my mother again as an example, she has a hand tremor, is not able to really fully fill in those circles on her ballot form. So I assist her. She tells me what her selection and her choice is, and I fill in the circle for her. So I have to sign her absentee ballot as well because I assisted her. Okay, we're in the final stretch here. You've completed your ballot, you've cast it, you've put it in the outer envelope, you've completed that outer envelope, you've double checked that you've signed it in front of a notary if you have to. Now it has to get back to the election board so they can count it. And there is a deadline with that. So that deadline is election day. Your ballot completed has to be in their hands, received by your election board by the close of polls on election day. Now, if what you have is an absentee ballot, you can send that ballot back by mail, or you can hand it in person, or a close relative can hand it in person for you. If you are voting a mail ballot, however, the only way you can submit it is through the mail. So again, keep in mind that these mail delays could result in a lengthy time for that ballot to get back to the elections office. And Missouri law is clear. If that ballot isn't there by 7 o'clock on election day, legally they cannot count it. So we're already seeing around the country, National Public Radio published an analysis earlier this week of tens of thousands of ballots that have already been rejected in just the few primaries that we've seen during this pandemic because they didn't get there in time. So 2 tips, if you get a little behind and you haven't gotten your ballot completed in time to get it mailed back confidently by election day, you can do a couple of things. If you qualify to vote absentee, you can still vote absentee in person. And this is true even if you requested an absentee ballot by mail. You can do a couple things. You can still show up at the office and just do that in person. You can cast that absentee ballot in the privacy of your home and just walk it back in person. You can also, and you can do that until 5 p.m. the day before election day. Absentee voting in person goes until 5 p.m. on Monday, August 3rd. If you haven't done any of those things, but requested a mail-in ballot, but you never got it sent in, what can you do? You take it with you to the polls on election day. As a last resort, you can take it with you to the polls, hand it back in other words, spoil that ballot, and then you can vote a regular ballot. So I just want to emphasize here at the end, there are other things I'm certainly happy to talk about, but if you have any questions at all about your right to vote, or if you are experiencing some hurdles and barriers with respect to your absentee ballot, please call the Nonpartisan Election Protection Hotline at 866-R-VOTE. It is live right now. We also have people answering the hotlines in other languages. There's a Spanish language hotline, Asian languages hotline, and an Arabic hotline as well. It's not only can we answer your questions about where you're registered, where's your polling place, and help you resolve a problem that you're experiencing, but documenting issues, particularly in this whole new scheme of how people are voting differently in the age of COVID, is really critical to being able to provide solid policy recommendations and advocacy to help make this process go smoother in the future. So thanks so much, and I appreciate the opportunity to be here today.
Thanks, Denise. Are there questions for Denise?
Thank you. How about house arrest prior to trial?
Great question. That's a great question. Under Missouri law, you can be disqualified from voting once you have been convicted of a felony and are incarcerated or on probation or parole. But if you have not been convicted of a crime, you retain the right to vote. And so that's going to include people who are, even people who are in jail. They have a right to vote if they have not been tried yet. So if you are under house arrest, that would be the same idea. I should also note that even if you have a warrant out for your arrest or unpaid parking tickets or past due taxes, none of that prevents you from voting. And police cannot stand at a polling place with a list of people who have warrants and wait for you to show up to vote, to arrest you. They cannot do that. You still have a right to vote.
How does a person do it if they cannot leave their home?
Right, so again, you would vote absentee. So people who are confined either in jail
Okay.
Or under house arrest would have to vote absentee.
Okay.
Okay, and they
Thank
do
you.
that by submitting that application. Now, I am well aware that this is can be a fairly complicated process, especially for people who are confined in a jail, because those ballots have to get notarized, and the mail. If any of you have ever attempted to communicate by mail with people who are in jail, it takes a long time and it's hard to do. But legally they are allowed to do it. And legally those jails have to facilitate you getting those absentee ballots. If you're under house arrest at home, it's the same thing. You can vote absentee because you will not be able to go to the polls on election day.
Thanks, Denise. Elizabeth.
I have a couple questions. If I decide that I'm going to vote in person on August 4th, because there'll be so few people at my polling place, does that invalidate my COVID excuse to vote in November?
That's a great question. No, it does not. While you can apply for absentee ballots for both August and November right now, those are separate applications. And so really the idea is your expectation that you are going to be prevented from going to the polls for this particular election. So you absolutely can, you always have the right to go vote in person, even if you've requested an absentee ballot. You can decide, you know what, I'm not going to do that, and just go to the polls and vote in person. You always have the right to do that.
Okay. The deadline of July 22nd, that's for the application, not the ballot, right?
That's correct. Your application has to be there by 5 p.m. on July 22nd. The actual ballot itself simply needs to be returned by election day.
And my last question, you said something about being able to hand in your ballot in person, but it sounded like that was not at the polls. Where is that?
Yes, you can do that at the polls. So if you request an absentee ballot, but you never get around to completing it, and you decide that and now you haven't gotten it in the mail, you can take it with you to the polling place. But take that, if you got it in the mail, take it with you to the polling place. You hand it in, that's called spoiling your ballot, and they'll give you a regular ballot that you can cast at the polls. You can presumably also do that during in-person absentee voting. So you could also take that ballot with you to the election board and just vote absentee in person, which you can do until 5 p.m. on Monday, August 3rd.
You know,
I have a
question. Okay, I'm sorry.
Oh, no, I was going to say, I have a comment about the absentee ballot. Last time, no, the time before, because I'm a poll worker, and the information on the front gives the impression that if one is a poll worker, that one does not need the ballot to be notarized. So I even called down to the Election Commission's office, and the person told me, no, I didn't have to have it. Okay, I mailed it back in. Then the day before, what's the name? Deb called me to say, you didn't have your ballot notarized, so you're gonna either have to come down here. So then I called somebody else, and because Deb left that message, and I asked them, then can I just go to my regular voting place and vote during my lunchtime from working on the polls? They told me yes, but because the absentee ballot was downtown and I didn't have it to present to them, it took a bit of about an hour for me to be able to vote because they had to call downtown. So my point is, if you've mailed it in and you think they didn't get it, they don't have it, then your vote will not be counted. So you really have to be careful about that, if you plan to go to the polls and vote and not have it.
They'll be provided, the election authority provides each polling place with a list of all the absentee ballots that have been received up until right before the polls open, up until the day before election day. But it is important to remember that most of the reasons to vote absentee do require a notary, including if you're voting absentee because you're a poll worker. So the two that do not are excuse number 2, that you are confined due to illness or disability. That does not require a notary. And excuse number 7, that you're at risk for COVID. All of the other reasons do require a notary.
Okay, I just wanted to ask real quick again. I just want to make sure that You're saying that we get the sample ballot in the mail from our election authority. We can take that with us on the voting day and submit that. Is that correct?
If you don't get it in time, yeah. So if for whatever reason you never got around to casting your ballot at home that you requested, take it with you to the polls. You can hand it in and get a regular ballot.
Okay, great. I didn't know that. That's good information.
Right,
And then also I was wondering
so,
if you could,
Charlotte,
Yeah.
I'm going to have Denise put her email in the chat box because there's just a few
Okay,
more
great,
things I
great,
need to
great.
announce, and we're almost out of time. So let's quickly, that's okay. We'll quickly go through these slides with a few things that I need to tell you. We'll skip telling you our mission statement and what all we try to keep you informed about today and go right to our current priorities. We are very disappointed that Governor Parson did sign Senate Bill 600 that we told you back in June. We had a veto campaign going on. He did sign it. Cost at least $16 million a year for harsher sentences. Research confidently and consistently shows us that longer sentences do not deter crime. The fiscal note says that the number of people incarcerated may increase by 2,500 by fiscal year 2038. And we know that new prisons cost around $250 million each to construct and over around $27 million a year to operate.
I can't hear you.
I think we
Hello?
lost.
It seems
Lost
JMO
J-Mo.
is also
I think we
frozen.
lost her, yeah.
Let's give her a minute and see if she comes back, because I'm not sure where she was in the announcements to finish up for us.
Denise, one thing that I wanted to add about people voting with criminal convictions, you can vote post-conviction if you're not in any type of supervision like probation or parole.
That's right.
I just wanted to make sure everybody knew that, you know. Okay.
Now you do have to register. So yes, once you are off paper, meaning you're off probation, off parole, you're eligible to vote. You do have to register. We've already passed the registration deadline for August, but no reason you can't get on it and be registered for November. And here in Missouri, we can do online voter registration.
Very good. Thank you both for that clarification. I think JMO is attempting to log back in, but I certainly can join us back where we were. This is an older version of her slides, but it is her slides. Let's see here. Can we see that okay?
Yes.
All right, very good. So I believe
I don't know what happened there. I got cut off. Can you hear me?
Yes.
All right, great. Thank you. So let's see if my slides will come back up. There we go. Can you see that?
Yes.
All right, great. So again, we want people to work with us to get those 2,000 contacts into Blunt and Hawley. We desperately need federal relief. There's a fact sheet that I told you about earlier. We know that 4 out of 10 Missouri households have lost income since March due to reduced hours or jobs going away because of the pandemic. 22% of Missouri households were unable to pay their rent in the previous month, as surveyed in the 7 days before June 23rd. 12% of households with kids are having trouble having enough to eat. And people who are homeless and contract coronavirus are twice as likely to be hospitalized, 2 to 4 times as likely to require critical care, and 2 to 3 times as likely to die than others in the general population. So we really need to get those contacts into Blunt and Hawley. There are horrible racial disparities that are revealed in the COVID pandemic fact sheet that we compiled with Coalition on Human Needs. Nearly 30% of Black households miss paying the rent compared to 18% of whites. 9.6% of whites in Missouri have no health insurance, but more than half, 50.2% of Blacks, close to 23% of Latinx, and 16.5% of Asians are uninsured. So please help us, and please recruit some people to join us in that. We want to remind you of upcoming meetings. Our Smart Sentencing Coalition will meet because of the special session on July 24th at 11 o'clock. Affordable Housing Coalition will meet with Sarah on August the 10th, and the HIV Justice Coalition next 24th at 1 p.m. You can find ways to sign up for all of those on our website. The next Empowering You webinar will be August 20th at 1 p.m. when our topic will be Protest, Police, and Policy, Be Part of the Change. So far, we have heard from Senator Brian Williams that he will be on the call. I just got a confirmation from Sarah Baker as well from ACLU, and there will be a speaker from the Law Enforcement Action Partnership, possibly Amos Irwin, but we don't know for sure because he's on vacation, but it will either be Amos or another person that's a good speaker from there. I've also invited Kayla Reed from Action St. Louis to join us to talk about Close the Workhouse and things that we've learned from that campaign that can help us be successful in advocating for police reform. So that's on August 20th. Mark your calendar now. That's how to get a hold of me. We have 4 minutes left for any questions that you have. Any questions for me? Any final questions for Denise, if Denise is still with us?
Yeah, is Denise still there?
Yeah.
She is, all right.
Hi, Denise. Could you give me that number one more time, the Our Vote number?
Absolutely. The Election Protection Hotline is 866-OUR-VOTE, 866-687-8683. This is live, and it's the same number all over the country, but we do have a national call center located here in Missouri. It does get answered by Missouri attorneys, especially on election day, but it is live now. You can call anytime to report an issue or to ask a question.
Thank you.
Any other questions for Denise or for anybody that was on the call?
Oh. Happy birthday.
Oh, happy birthday.
Thank you. Thank you. Well, this was a wonderful way to celebrate my my birthday. Thank you, Linda, for the feedback. Please help us get those contacts into Blunt and Hawley. It is so important that we do that, and you know, share the links from our website on your social media platforms so that you get people to join in that with us.